My name is Jason from On Your Mark Fitness. Today I want to discuss the knee joint. The knee joint is one of the most injured joints in the body, especially among players in sports with a lot of change of direction or repetitive actions like running. Yesterday I started with two new clients. I'm going to use them as the example. They both have some issues with their knees, and they both present with similar lower body dysfunctions. Both clients have femurs, which is the bone in the upper leg, that because of weak hips want to internally rotate or cave in. While their lower leg, the tibia, again, because of some muscles that are a little weak and others that are too tight, wants to externally rotate. So their knee is basically doing this. Now, one is a athlete in a sport where there's a lot of change of direction, and the other one's a runner. So what's going to happen is, in the case of the soccer player, that knee doing that on the field is going to cause a lot of knee issues and probably potentially an ACL tear. Whereas the runner, it's not as dynamic or impactful, but what's going to happen is that's going to create some tendon issues in the patella tendon because of the way the knee's collapsing. So while both clients have some issues that we need to work on, how we're going to get there is going to be very individualized because each issue is caused by different muscle in each of the two clients that I met with. So while we'll be working on the same joints, how we approach it will be very individualized. It's important that the release techniques, which I've shown in other videos, some of the corrective stretches and muscle activation techniques, they should all be very specific to the individual, not just random exercises thrown together. It's very important that you figure out which muscles are tight and overactive and which muscles are lengthened and in a weakened state that need to be strengthened. And that's the best way to balance it all out, and that's the best way to make sure that you get the best possible outcome in avoiding injuries and starting to also recover from some of these sports or overuse injuries. And that's just a quick synopsis of how I approach working on the knee joint. Thank you.